How do we use platelet-rich plasma in someone who has knee pain? Hello, this is Dr. Siddharth Tambar, expert in rheumatology and in regenerative medicine. This is a good case of someone who I treated today where we can really delve into how we utilize platelet-rich plasma in knee pain. So this is a case of a 35-year-old woman who's presenting with chronic left knee pain. I've known her for a couple years. I'd originally treated her right knee, which had a more severe issue. We utilized her own bone marrow-derived stem cells. Her right knee is doing great. Her left knee is, however, causing her some issues, and so it's not as bad off as the right knee, so we ended up utilizing platelet-rich plasma. On her imaging and exam, findings are consistent with likely patellofemoral joint pain that shows some degree of moderate level arthritis in the patellofemoral joint. So she's had other conservative treatment to begin with, and she's failed physical therapy, leg and core strengthening, supplements, anti-inflammatory medications as well, and activity modification, as well as weight loss. So in her case, we ended up choosing platelet-rich plasma, utilizing platelet-rich plasma because, number one, it's a good next step option if you failed conservative treatment for knee pain or knee arthritis, in particular because she has mild to moderate level arthritis as opposed to more advanced arthritis. More advanced arthritis would do better with bone marrow-derived stem cells. So in her case, platelet-rich plasma is what we chose. So what is platelet-rich plasma? It's essentially a process where we take a blood draw from you, concentrate that into a high concentration of your own platelets, and then re-inject that into the tissue that is damaged and causing pain. So in her case, her treatment included the following. To begin with, she has a Baker cyst. A Baker cyst is a collection of fluid in the back of the knee. So in her case, she developed this Baker cyst because she has chronic instability in the knee that's leading to a bit of inflammation and then swelling in the back of the knee. First off, we ended up draining the fluid from the back of the knee, from the Baker cyst, draining all the fluid out until it's totally evacuated. Important because the Baker cyst itself, in her case, is putting compression against the muscles, tendons, and nerves in the back of the knee, creating more discomfort and difficulty with activity. Next, we ended up treating her patellofemoral joint where she has her pain with her own high concentration of platelet-rich plasma. We then also ended up treating the supporting ligaments and tendons around the kneecap as well that are subtly weakened and unstable, which is what's causing her pain and discomfort to begin with. Post-treatment, she will have more inflammation for the next 2-3 days. She'll reduce her activity level for the next week or so, otherwise continue her normal activities of daily living, and even likely participate in some lower level exercise that she's able to do. My expectations are that after about 1 week, she'll be back to her baseline level. She'll be noticing improvement at around the 3 to 4 week mark and then getting better for the next 6 months or so. Overall, I think she's a good, not only candidate for treatment, but my expectations are that she will actually do well with treatment as well. And I think we'll be able to not only treat her pain, but also increase her activity level to a point that she's happy with. The keys to this case are, number one, picking the right orthobiologic treatment, in this case, selecting platelet-rich plasma for her knee pain, then injecting and treating under ultrasound guidance. Always essential that for any kind of regenerative medicine treatment that we're utilizing high-level image guidance, whether that's with X-ray or ultrasound, and in this case it was ultrasound. And the reason why it's essential is because if you want to be precise and get the best kind of outcome in your treatment, or in this case my patient's treatment, you have to utilize ultrasound and X-ray guidance. And then lastly, making sure that we're not only treating the joint, but treating all the other supportive structures around the knee joint as well, which is called prolotherapy. Important because your pain is not only coming from just the knee joint, but it's also coming from all those other structures as well. And in order to maximize function as well, we need to also improve all those soft tissue structures, which will help her get back to the activity level that she desires. I think she'll do great, and I think this was a really good case of utilizing PRP treatment in someone with knee pain.